Senator van Turnhout.
Thank you very much. I wish to second the bill and to welcome the Minister to the House. I'd like to begin by thanking my colleagues, Senator Crown and Senator Daly, for their collaboration and commitment to this important public health and, I believe, a children's rights initiative. And I would also like to echo Senator Crown's words on young Fionn, and I think if he was here, he'd certainly convince everybody in this chamber of why this bill not only needs to be brought through this evening, needs to be brought through without delay. Article 24 of the UN Convention on the Rights of the Child states that state parties recognise the right of the child to the enjoyment of the highest attainable standard of health. By banning smoking in cars with children present, we aim to protect the health of children who cannot otherwise protect themselves. And in leading up to this debate, I'm not immune to some of the concerns that have been raised by others. In fact, it reminded me in the lead up to the ban on smoking in the workplace in March 2004, the month preceding. I myself wasn't convinced that it would work, and was it right? Because I'd become accustomed to the experience of being in the local pub or going into a cafe for a coffee, only to leave with the smell of smoke on my hair, on my clothes. In fact, smoking had become so normalised for me. I didn't know anything different. I was like the prisoners of Plato's cave. I had accepted the dancing shadows as my reality. Yet, at very least, this mistake was one which I had the autonomy to make. Children up and down the country do not enjoy this luxury. They cannot extract themselves from smoke-filled environments as I could. Oftentimes are less aware of the dangers of second-hand smoke, while those who know the risks may not be in a position to challenge their parents or the adults who are driving them. Indeed, they shouldn't have to. All children believe that their parents can shield them from danger, and that is a fiction I believe they have a right to believe. Children should always feel safe when with their parents. They need to know that if nothing else, their mothers and fathers will always have their best interests at heart. By regulating this behaviour, we're taking the onus off the child and placing it back onto the parent, challenging them to live up to the expectations of their children. I'm sure everyone will agree that the medical evidence presented by Senator Crown is utterly compelling. Yet in reviewing the arguments, I'm reminded of a piece of anecdotal evidence of a bartender once told me before the smoking ban he'd wipe down the bar every night, and without fail cloth was covered in grime. Every single night, thick grime. Once the ban came into force, he said he only had to wipe the bar down twice a week and the same level of grime was not there. And that really put a picture in my head of how much that we don't see. And while it's only an anecdote, I can only imagine the effect of a prolonged exposure to such levels would do to the lungs of a child. Indeed, according to the British Medical Association, the level of toxins in a car can be up to 11 times higher than in a smoky bar. In 2009, the National Longitudinal Study of Children noted that approximately 60% of 9-year-olds in Ireland travel to school by car, with an average journey time of 10 minutes. So to and from school, they spend at least 20 minutes a day in the car. In addition, we know children are driven to sporting activities, youth, other events, to homes of friends, for doctors and other appointments. So all that time adds up that a child is in a car. However, for those children who are exposed to smoke during these journeys, they represent a substantial risk to their health and their well-being. Thus, efforts must be made to ensure that these children enjoy the same protection that we have already afforded to adults. The simple fact is, we all believe that we have a right not to be harmed or subjected to a significant risk of harm. So when it became widely accepted that inhaling second-hand smoke posed such a risk, we legislated for this behaviour. Thus, if you believe that a child has the same right to protection from harm that adults enjoy, then there is a corresponding obligation, I believe, to protect that child from the danger of second-hand smoke causes. Indeed, the risk of harm from exposure to smoke is greater in the case of children. Children are far more sensitive to tobacco smoke because their lungs and their bodily defence mechanisms are still developing, because they inhale far more pollutants per pound of body weight than adults, and because they are more likely to have allergies or other conditions which make them more sensitive to airborne pollutants. I've heard arguments that this legislation should be part of a wider prohibition of banning smoking in public places such as parks and beaches, and I do think that maybe there is a need for greater public debate, and I welcome what the Minister has done to raise awareness of the public and to start and commence that public debate. The bill put forward here today deals with the very discrete issue of smoking in cars with children. And maybe I should note that I do think, and I appeal to county councillors around the country, that to use the bylaws and regulations that they have to maybe look at areas such as playgrounds where children are in or directly around. I believe, for example, Fingal County Council is hoping to put it in place in the near future. Sometimes councillors say they don't have powers to do certain things. They have powers to do this. So I would appeal to county councillors to use the powers that they have where children are directly put at harm's way. I'd ask the Minister, I'd echo the calls of my colleague Senator Crown, to ask the Minister to accept the bill today, but not just in accepting it, but give a commitment of what will happen over the coming days and weeks. I'd ask the Minister to outline a clear timetable for the next stages of this bill. My hope, like Senator Crown and I know Senator Daly, is that this bill would be in place for the summer holidays so that children would be able to go on holidays in a smoke-free environment. I think this gives us enough time to consider any amendments while also setting an urgency to protect children's health. For me, the aim of this...
1 minute left.
No problem. For me, the aim of such measures is to denormalise smoking. This bill, for me, is about protection. It's about protection of one of the most fundamental rights, the right of the child to the enjoyment of the highest attainable standard of health. Minister, I'm very aware of your commitment to this issue. I'm hoping that today will be a first step of soon, very quickly steps that will see this legislation in place. So it's not just talked about, but we can show the power that we can make to improve and protect children's health. Thank you.